Good evening, everyone. Welcome to The Work Continues Black HIV Community Leaders Converse. I'm your host, Tiana Burton, but you can call me Ty. I use she, her pronouns, and what I enjoy most about the work that I do is being in community. As the project manager at LGBT Detroit, I work alongside our program coordinators to ensure that they meet their goals. And that's what prompted our panel discussion for today. Tonight's panel features healthcare advocates, public health officials, prevention, education, and youth leadership specialists who will be speaking to service and impact from a professional lens. We are all a part of the movement, and our goal is to eradicate HIV stigma and increase education and prevention. Our work intersects in various ways, so we are here to exemplify how that work comes to fruition. Now, I'm going to introduce you to our panelists. First, we have Curtis Lipscomb, who is the Executive Director of LGBT Detroit. Deontay Brown is our Program Coordinator for the LGBT Detroit Leadership Academy. Akila Benton is the Detroit Health Department Ending the HIV Epidemic Manager for the City of Detroit. Dr. Latonia Riddle Jones is the Vice Chair, Chief Diversity, Equity, and Inclusion Officer for the Department of Internal Medicine at Wayne State University, as well as the Medical Director for Corktown Health. And LaDawn Tate is an Early Intervention Services Specialist for Corktown Health. Tonight's theme, work hard, play hard. We all play a role in ending the HIV epidemic. So let's get into the conversation. So first, I want to start by asking, what does it mean to work on behalf of those living with HIV? Specifically, what brought you into this work, and then what sustains your advocacy? Think about it for a second if you need to. That's okay. Take some time.
I can go first.
Yeah, just go ahead.
I'll go ahead and tell you all a little bit about what got me into this work. So as a medical student at Wayne State School of Medicine, I needed a job. And I found out about a really cool opportunity to actually have hands-on experience with patients. And so I actually did rapid HIV testing in the emergency department at Detroit Receiving Hospital. That was probably the best job I've had to this point, because I got a chance to talk to people about testing and knowing their status. And this is before it was in vogue, before it was popular. So, I went to every single patient in the emergency department, talk to them just about HIV, what it really was, and why it was important for them to know their status. And I remember maybe 3 years into that job, I had a patient who was about 17 years old, and this person told me they wanted to get tested. The test came back reactive. That was my first reactive test when I was by myself testing. And I remember being really, really anxious, really nervous about delivering that information to let them know that they needed further lab work so that we could see, if we were confirming the diagnosis or not. And so I worked up the nerve to go talk to the patient, to do some counseling. And this young man told me, darn, I was hoping it would be negative this time. And so he already knew his status, but he was just hoping and praying that it would change for him. And then I got to know a little bit more about him, and he was born with HIV. It was transmitted, vertically from his mom. And he said that he was from New York, but he was just traveling to try to see all 50 states before he died because he wasn't on medication. And so we had a good talk. We also talked about medication and the fact that, HIV doesn't mean you die. But he said that he didn't trust the information he was getting from anyone, but he trusted the information he was getting from me because we shared an identity of being Black Americans. So that right there told me that I needed to keep doing what I was doing and figure out how I could reach more people. So that's what got me into this. And I'm so happy that I get to continue that work and do more work. So I forgot the other part of the question because I was talking so long.
It's okay. Oh, goodness. It was what sustains. So is that
what sustains me is the fact that my patients accept the information coming from me and that I get to teach students. because we talked about having an impact, that's where I've been able to have the most impact. You know, I'm one person, I can only see so many patients one-on-one, but when I'm teaching students how to talk to people, just how to communicate, that's hopefully going to make a difference. It has so far, so I'm hoping it makes a bigger difference in the future. So that's what sustains me.
Thank you for sharing that. It was a really beautiful story.
Go next if you would like.
Yeah.
Okay, so I have been in the field for well over a decade now. When I was in undergrad at Wayne State University, I interned at the health department. I worked for the Infant Vitality Action Network, working with mommies and babies and reducing numbers of infants that are dying before their first birthday. And working at the health department, I was also introduced to many other departments as a young college student. So I did a little bit of HIV work and research while I was in undergrad, but then I later went off to grad school down in Florida. And I remember in grad school, me taking my little resume to like every single one of my professors, like, I need a job, I need an internship, very similar to Dr. Riddle, like, I need something. And one of my professors said, I don't have any money to give you, but I can give you this unpaid internship. And I was like, I'll take it. Like, I want it. I want the experience. I want to, spread my wings in the field of public health and like hone and enhance what I wanted to do for my career. And lo and behold, like, that was the biggest blessing ever, this unpaid internship. Because essentially what it was is she had an NIH grant for technology-based adaptation of healthy relationships. We're all very familiar with healthy relationships, but it was a technology-based adaptation of healthy relationships for women living with HIV in Florida in rural settings. And the idea was, when we talk about social support, and we all know how important that is, a lot of women and a lot of people living with HIV are very isolated. And Florida had a lot of rural areas. So the idea was that some of these health centers and clinics having this technology in place. And then we had a facilitator at the University of South Florida that was facilitating healthy relationships virtually. And so that was my inception, my intro into doing a lot of HIV work. And I fell in love with the work. I remember the work being very hard because what I was doing was I was interviewing different women, learning about their different experiences. And I remember at first being, having trouble sleeping at night because I was so saddened, but encouraged. I talked anywhere from women who were sex workers to women who got it from their husbands, or it was just that, when we talk about stigma, I know we're going to get into it, like it's just a wide range of ways in which people are stigmatized in the community living with HIV. So that was my experience. And then for my internship for grad school, I ended up going to South Africa and doing a very similar work with women living with HIV around some of their reproductive health and decision-making skills. So some of these ideas around if women in South Africa wanted to get pregnant, like some of the language barriers, some of the cultural things, some of South Africa being a very misogynistic society, rape being very high in South Africa, working with some research around women living with HIV on their reproductive health. So that was an amazing experience. But despite everywhere I was, it was something about Detroit. I was like, I went away and got this knowledge, right? And I want to help marginalized people. I want to help people of color, as a woman of color, as a person of color. So it was important for me to come back home. And I made the decision to move back to Detroit during a time where a lot of my peers had left and weren't thinking about Detroit. You all remember Detroit was going down. No one wanted to live here. Downtown was destitute. It's like amazing now, right? But I came back when it wasn't amazing. Now everyone is trying to come back. So I got my first job here at AIDS Partnership Michigan, now unified, and have grown and matured in the field and learned so much. And I'll say the the thing that definitely sustains me is there's so much, like we've come so far, we've done a lot, but there's so much more that needs to be done. And stigma is a huge barrier to people living with HIV. And so the thing that sustains me is knowing that we have a ways to go, but also the progress that we've made, making differences and being able to, again, create these opportunities that are able to grow young advocates in the field that otherwise might not have had these opportunities. So here I am.
I really appreciate that. Thank you. LaDawn, what about you? How do you feel?
So what made me get into the field is more so of a personal reason. When I got diagnosed because of, I don't want to say the ignorance of not knowing that you had to ask for an HIV test. And, you know, my provider didn't encourage it. You know, I felt like it was her job to like, okay, she don't have the knowledge, so let her know, like, hey, would you also like to get this type of test? And when I got diagnosed, I really felt some type of way over that. Like, how many other people don't know? Because you learn this stuff in school, but that's some information that they leave out that you got to go in there and ask or sign a piece of paper. Or when you go in there and actually get an STI panel, that HIV is not a part of that panel unless you sign a piece of paper. So, you know, I felt some type of way over that. And I kept bugging my doctor, like, dude, what can we do? Like, why is not out here like this, you know? And my doctor actually brought me into the field because he felt my concerns. And I guess he saw something in me. And Lord knows, oh yeah, I came out. On social media about my status. I started being reached out to from different women across the world. I started getting involved in, you know, national advocacy policies that'll teach you how to do things. And I was like, okay, I could do this. I'm already a talking person, so let me be heard for something. You know what I'm saying? Let me let people be aware. And not only that, it's what makes me stay in the field is knowing that I can give a person hope. Because they look at me and they be like, girl, you lying. You ain't living with HIV. I'm like, girl, yes, I am. That's because I take my medicine like I'm supposed to, and you can do it too. So being that peer that people can actually relate to is what gives me my thrive. I have a special connect with the people that some can't reach.
I love that. Thank you. Tay?
So I also have my own personal reasons as to, you know, my connections with the work. I know I'm actually new to the field. I've been working at LGBT Detroit for a little under a year now. And for me, it was just really understanding and seeing for myself that 1 and 2 is real. For myself, and coming to terms with my recent, very, very recent diagnosis, I never wanted anyone else in my community to have to go through what I'm going through right now. It's very hard. It's difficult, especially in the beginning. But when you have the right people in your corner to support you and to help you navigate this, then anything is possible. And so for me, I want to make sure that people are aware that they can live healthy lives with the diagnosis. That's what's really important to me. And, you know, when I first entered the field, you know, I'm not gonna lie, I just saw how certain things like played a role for those that were close to me. And it just really began to just shift like my thinking about how I even saw HIV. And so now every day on my mind, I just brainstorm what are these different and dynamic ways that I can provide education and connect with young people, because it really starts with them, in my opinion, so that we can actually take more concrete preventative measures so that they're not diagnosed. And so that's what's really important to me. And what really sustains me, you know, compared to some of my other peers that are on the panel, is that I work directly with the youth. And so I'm looking to instill education into new leaders so that they can go out into the community and educate others that they know and really debunk a lot of these myths and these stigmas. And that's what really sustained me, because it's always going to be the young people that's going to fuel the movement. We all know that. And so that just gives me a lot of joy just to see my proteges and our young people that advocate for HIV care, prevention, and really just ending the stigma.
Thank you for sharing that. Curtis?
Thank you.
That's a great question. For me, I came out as a teenage person, as a teenager before HIV was a known entity in the United States. By the time that I entered high school, the knowledge of HIV was a cultural experience. So if you lived in the East Coast, the Village gay ghetto, or the West Coast, the Castro gay ghetto, that was when the infections were the highest and people thought it was isolated. We lived at a time that nobody saw that before. And so by the time I was a teenager to the time in my late 20s, as an out gay person, I saw firsthand the deaths of many people around me, and many of them were my friends. Though I entered my previous field not thinking that I'd be living within the impact of HIV, my heroes died of HIV, as the creative class was the first group of people that was hit hardest with infections in the 80s. It hit me personally when my best friend died in my arms, and that's when I decided to leave my own profession, dedicate the rest of my life to make sure that others do not succumb to HIV and AIDS, like my best friend, Robert Pennick III. Since then, I entered a space in Detroit where a number of people, about 100 people, would meet on a Tuesday. And at Men of Color, people who either was impacted, infected, affected by HIV, that space created healing and education. And that led my journey to the destination where I am right now. And so what impacts me again is that, you know, in my seat, you are to work your way out of a job. I mean, you want the mission to end. And unfortunately, I live at a time where the mission hasn't ended. So what sustains me is the need to still educate, the need to still make sure that people like me don't get HIV. And if so, find whatever needs that they can get to make sure that their quality of life isn't badly adjusted with the new diagnosis.
Thank you for sharing. I love that all of our professions kind of just like intersect in these really amazing ways, from like this civic level down to like this on the ground, direct community work way. From a professional lens, how would you describe HIV stigma? What misinformation regarding HIV/AIDS would you like to address? And then what are some ways that we can benefit from operating from a place of anti-stigma? I know that's a long question, but each answer kind of feeds into the next one. Who wants to start us off?
Well, I like to start first, as I started last, I ended last. And stigma is critical because since the awareness of the disease, which was at one time called GRID, gay-related infectious disease, the stigma was very real. So if you were gay, at this point, gay equaled HIV. So if you were gay, you had HIV, not necessarily diagnosed, not necessarily proven, but you had HIV, and you were treated quite differently. There was a brief window before the 80s when this gay lib movement exercised the ability to be yourself. And so you had this period where people were coming out and being themselves. That was a very short time. Suddenly, these same people were hit with this new identity, and it reversed and changed any advance that gay people felt within the work for equality. So the stigma hit like a rock. It then moved from a predominantly white male experience to the late 80s being this newly Black urban identity, which then inflamed stigma because for a number of people who live pretty privately, Black people are primarily social conservative types of people. This new identity was another layer of oppression, another layer of a negative identity that people just thought was too much to bear. And so that also impacted health because, you know, if you didn't want to let people know you were sick, then you wouldn't go to the doctor. And if you were sick, you probably didn't tell your partner, so you may pass the infection, which meant your circle got wider and wider of people infected with HIV and AIDS. And so, hard time. I'm very grateful for a number of people who left their careers and entered the work to make sure that others felt safe, but there still is a long way to go as there are people born within the height of the HIV epidemic. There is little to no education about HIV transmission. And I'm personally upset about that because that makes my children and daughter more and grandchildren more at risk of this epidemic. And so
thank you.
There's a lot of work to do.
Yeah, absolutely. Is there like specific misinformation that you would want to address? Like other than providing education and prevention and even with the organization as a whole, like is there just something that you just wish was not a thing?
Yeah, and I say this now, coronavirus is what people think HIV was. People believe that HIV jumps on the body. So if I touch you, you have HIV. If I stand next to you, you have HIV. People literally move their bodies thinking that you can catch HIV by just being next to you. Mm-hmm. Coronavirus is exactly what people thought HIV was. I could stand next to you and transmit another type of deadly virus, but with HIV, that's not the case. Yes, body fluids are the most known, highly known method of transmission, but droplets, as we know with coronavirus, is this new method of spreading HIV. And so I wish that education was available so people know that, but people need is compassion, not to be separate from.
Thank you. Thank you for that.
That was so good, Curtis. I like, you know, and I always appreciate kind of having these conversations and having these conversations cross-generationally to like, kind of, it's, you know, we've heard some of these stories before, but it's always refreshing to like hear the historical context of stuff, because when I enter in the field, it's completely different than when someone like Curtis entered into the field, and the history, like we have to learn from the past, right? So we can change things in the future. And I'll like kind of jump around, so speak, because we just talked about misinformation, and I think something that I would like to see more of in terms of misinformation is this idea, and Curtis kind of said it too, that HIV only affects the LGBT community. And it only affects a certain demographic, a certain population of people. And, you know, this, it's all full circle because it kind of speaks to LaDon as a cisgender woman. You know, I do think that there's a big gap in a lack of education among providers, among cis women in the community about HIV and who really is at risk and if you are at risk or not. And so I feel like people don't see how it affects them until it affects them, right? So I think that's definitely something I would like to see more of. And I see the work that we're doing in the community. I see the way in which people like LaDon have like worked intimately with people and mentored them and guided them. But in terms of like stigma from a professional lens, for me, I mean, we all know stigma, you know, is this idea of these negative attitudes about people who have HIV and are labeling them as a result of that. And it comes with a variety of things. You can't sit on the toilet after somebody. You can't hug someone. You can't, all of these things. Or, you know, if you have HIV, you must have got it this way, and this is the only way you could have got HIV. So I think from a professional lens, that's how I see stigma, and a severe lack of education. But I will say, in just listening to Curtis and listening to the ways in which our programs have changed, you know, back when we entered the field, there was no U equals U. And, you know, I've had conversations with physicians that said, we've always known that U equaled U, but it was something that we couldn't say and, you know, spread in the community as a sound message. So seeing the ways in which we have learned from the effects of stigma and discrimination working in the community is important. And then another thing, when we talk about stigma, one of the projects that I first started working on when I was at APM/Unified was the Stigma Index, which was an amazing project. We did the first implementation in the US, but one of the things, a lot came out of the Stigma Index, you know, having conversations with people who are living with HIV, and a wide range and diverse population of people, and learning about what some of these stigma and barriers are. But a big thing that came out of the Stigma Index was internalized stigma, how people living with HIV see themselves. And some of the data from the Stigma Index kind of showed, I think over 70% of our participants that we interviewed blamed themselves. So when we talk about addressing stigma, I think there's work that we need to do in the community, in all of our communities, but I think also addressing these ideas of internalized stigma and self-blame, which has further perpetuated isolation, depression, anxiety, coupled with living with HIV and being a Black person living in America. Because I think when we talk about stigma is not new to people of color, right? Mm-hmm. So like being stigmatized just because you're Black, but then now you have to deal with stigma because you're Black and because you're HIV positive and sometimes because you're a part of the LGBT community. So it's a lot. It's a lot. So I think, did I answer all your questions, Tiana? I don't know if I did. I feel like I'm rambling. Like I want to have a discussion.
No, not at all. That was great. That was great.
You know,
no, and Akila, like some of what you said just had my brain thinking, you know, moving in all different directions. But a couple of things. There's so much going on here. So one that I encounter all the time is the fact that people think they can't have children. And I have to explain that to them. And then they'll tell me, no, a doctor told me that. That is heartbreaking, okay? Especially for someone who that's one of the things they want to do their whole life. I just want to have a baby, or, you know, we want to have a child. But for them to think that that's been robbed of them when it hasn't, that has not been robbed of them. Yes, even if you have HIV, you can have children, biological children, you can carry, okay? So that's one thing. But the other thing that you spoke to was people not knowing they're at risk or getting misinformation about, you know, who's at risk and who's not. And Curtis, you kind of spoke to it too, you know, thinking that it's just, you know, someone whose identity is gay or, you know, trans. I have so many, you know, cisgender women in heterosexual relationships come and see me and they'll talk to me and I'll ask them about PrEP. Do you know about PrEP? So pre-exposure prophylaxis to prevent HIV transmission. And they have no idea what it is. And when I explain to them what it is, then they end up coming and telling me, you know, I don't know if I trust my partner, or I know my partner has multiple partners, but, you know, in some situations, they're afraid to even ask. They're afraid to approach the topic. And so when I tell them that, you know what, I have something that can really protect you, and you don't have to disclose you're taking this medication, but this is just something that can be for you. I can't believe how many of my patients jump on that. And then I'll have medical students and residents say, well, no, they're not at risk. Yes, they are. They are at risk. And so just opening the eyes of the students, opening the eyes of my patients, just getting the correct information out there. It's just, that's what feeds me. That continues to feed me too. But yeah, no, thank you for saying what you said.
That's the information that I wish people can understand and be out there. If you're having sex, you're at risk.
Absolutely.
That part.
It doesn't matter no
Yes.
way, no
Yes.
how. If you having sex, you are at risk.
Well, and then
yeah, but then
go ahead, LaDon.
Michigan's so conservative, you can't even really do the commercials. Like, you know what I'm saying? If Michigan was not so conservative, right? Do you know the type of commercials that we can actually put out there to actually get the message across?
Mm-hmm.
You know, and that's another thing, Dr. Rose, you hit it. Healthcare providers. I mean, that's kind of what made me really like get in the field, because I felt like my doctor could have prevented this whole situation. All you had to do was just educate me on some information. But then you come to find out they're not even educated on the information. So it's like, okay, so when is that gap gonna get filled?
We're working on it. We are working on it. We have public health physician detailers now as a part of our EHE team. The state has them as well, that are putting together these trainings specifically for clinicians on taking sexual health histories, and not just ID doctors. Because here's the thing, like, your gynecologist, your general practitioner, they aren't asking these questions. So those of us who kind of have the efficacy to kind of have these conversations, I'm going to say, no, I want an HIV test, but otherwise, if I didn't say that, like LaDon, my practitioner would not give it to me because I don't meet these metrics. Absolutely. Based on whatever questions that you're asking me, instead of, have you had sex? Are you doing X? You need to take this test. So, I think it's our part to work with practitioners, but also empower the community and have these conversations on, no, this is your body. You have to take agency for these things and have these conversations, and here are the skills to do that.
Absolutely. And if you have questions when you're in your doctor's office and they're not answered, no, you keep asking those questions until you get answers that you understand. And if that provider is not giving you answers that you understand, you need to find another provider. Okay.
Right.
So that's right. Please pass that message on.
They treat you bad. And then add the fact of being in a lower socioeconomic class and a resource limited setting. Like, we're not new to this. Like, we know that in the inner city, at these providers' offices, people are treated differently. You're not treated with love and kindness and grace. You're stigmatized solely because you're walking into this specific clinic. And that's a problem.
Absolutely.
I guess that's why I live the way I live, because I want other people to see that you don't have to live in fear or live in shame. You know what I'm saying? Shame them for not knowing their status. I mean, they shaming you. Ask them when the last time they got tested. I walk with Gracie with my diagnosis, and you know what I'm saying? Stigma is so real. And I even hear a lot of women that say they don't go on dates because they don't have time for this. And no, honey, go get cute and you take yourself on a date. I'll guarantee you sitting up there looking cute, somebody gonna buy you a drink or offer you some water.
Absolutely. Absolutely.
Oh, Tay, I would love to get your perspective.
Yeah, because I think we're having a good conversation about practitioners and things like that. But I think there's another conversation we need to have about the fear about HIV and where is that really rooted from. And for me, I'm really of the opinion that language really plays a huge role in HIV stigma, right? Especially when people are negatively describing HIV. And I'm talking about that in the sense of like, the noun, but even those that are living with HIV. I think that we all heard of that phrase that says like sticks or stones may break my bones, but words will never hurt me. But that was a damn lie. Like, words do matter. And when we talk about HIV and when we talk about the stigma, words do matter with that. Think about how so many times you've heard of, so-and-so was infected with HIV, or, someone was engaged in some risky behavior and that's how they were diagnosed with HIV.
Full-blown AIDS, full-blown HIV, language like that.
Exactly right.
Wait, what's that other one? They be like, are you clean? Before like any type of engagement happens, they ask you like, well, are you clean? You get tested, like language, yeah.
Exactly. And so I think it's even something for us as like community leaders or advocates that we need to be conscious of, because there's a lot of times that we even use that own stigmatizing language with our own clients. And so if we're really going to talk about, ending the epidemic, we have to first work on our own language, because we know that it's causing the fear and it's causing the issue with individuals wanting to learn more to access the preventative care, for us to even get to the education. And so I think that we need to really address like language more importantly with this.
I love that.
Even with providers. Y'all see me when we be in them little conferences and the providers be saying, nope, it's diagnosed. I'm not infected. I'm diagnosed. That stuff makes a difference.
And we don't know
what? There's so many times that providers haven't been corrected, or they may not even know that. So that's why we need you all to keep reiterating that and keep saying these things, because like, trust me, most of my colleagues have never heard that before. Okay. So yeah.
I appreciate all of y'all for sharing, talking about HIV stigma in ways that we can all be better. Within your abilities, how would you describe your impact to end HIV epidemic? So this can be from a personal lens, this can be from a professional lens. And I kind of want y'all to dig a little bit deeper into your specific roles at work. So like Tay, with like working with the youth, and like what type of programming you do, what type of things do you do to make an impact?
Yeah, I could definitely start off with that one, because I'm actually planning a couple of events actually later this summer to continue with the conversation regarding stigma. And I think part of it has to be truly dynamic, right? I think that at this point, because, we've all been locked down these last 2 years, everybody then got zoomed out. And so a lot of people don't want to sit in these lectures talking about mitosis and cells and, that kind of, information. We need to do that in new, fun, and exciting ways, so that people can actually feel and understand the experience of HIV. And I think that's what's the difference, because when you actually feel something, it becomes a little bit more closer to your heart, so that then we can actually move to, again, more about education and then talk more about prevention. Because what we have to do first is address that fear. And then once we address that fear, it really opens that door so that we can then talk more about PrEP, right? And then maybe we can talk more about how exactly are you communicating with your partner or even partners, about the kind of sex that you're engaging in, so that you all can be safer and healthier in the ways that you all engage. And so some of the things that we're looking at right now, without, sharing too much, is that we're actually going to be planning like a little water balloon game. And so what we're doing is we're going to be actually passing out these different cards so that people can see like the different like abilities or lack of abilities that they have. So they can, maybe they'll have one about how they're isolated and how they maybe feel about that. Or maybe they'll have another card that talks about that, hey, like they can only like hop on like one leg. These are just like some examples of like what we'll be doing. And so the goal here is for them to just understand what that experience is for those that are living with HIV, especially maybe at the beginning, so that then they can have, and again, more internalized feeling about the experience. And then that can open the door for us to have a more productive conversation about this as a whole. But I think that we just need to find, at least for young people, just different and dynamic ways to provide different ways to connect and for them to feel it. And then that's how we can actually like tackle it and provide that education from there.
I like that. I really like that. Anybody else want to jump in, chime in? Let me know what y'all doing.
Me, okay, I wear a lot of hats, okay?
Okay.
And some things people wouldn't know that I do, but I do. So, far as with Corktown, I am an early intervention specialist. So what that is getting people that are newly diagnosed or people that are returning into care, that are getting back into care, pretty much in care, and trying to help them stay in care, which is like pretty much trying to help them eliminate barriers that's preventing them to stay in care. So that's my role far as with Corktown. But on the outside life, on the volunteer tip, I do sit on the council, Southeastern Michigan HIV/AIDS Council. I do sit on the Part D Women Advisory Board. I do sit with the Positive Women Network, and I also am a part of the National Minority AIDS Coalition. With the Positive Women Network, my role with that is on more of a political level. When it's time to get out there and vote, I need to go and talk to those officials that's running, and I need to make sure that they understand what it is that we need out here. And I need to make sure we all on the same page. You want my vote? I need to make sure you on the same page. So I actually does go out and actually meet the people that are running, whether you want to be mayor, whether you want to be government, whether if you want to run for a seat as the Senate. I need to meet you so I can understand and make sure that we're on the same page, that I'm making a great decision when I vote. As far as with MMAC, it's more of a training aspect. I like to train other people to become leaders. Mm-hmm. So women is my main goal. I like to empower my women because I don't see a lot of me out here. So I like to empower my women. And far as Part D and SEMHAC, I'm the backseat behind the boys type person. I mean, we do have a project in the working. I'm not going to go there like Tay. You know, I got some secrets.
It's the plug. Now is the time to plug.
You know, and it is for women. So, you know, women in housing is like a big thing. Women housing children is a big thing. So, I mean, we got things working up, but those are just some of the things that I do and how I try to make an impact.
Okay. Let me hear from somebody else. How y'all making an impact?
Well, it's the title of my job. Ending the HIV epidemic manager.
Yes.
Woo, that's stressful, right? Angel tells people all the time, Akila's gonna end HIV by 2030. Like, Angel, simmer down. That's a lot of stress. But so program development, like that's my jam. So I've been on the nonprofit level prior to coming to the health department for 7 years at Unified. So I know what it takes to run programs, to design them, to implement them, to gain community need. But now on this other side, which I love the knowledge and the experience and the skills that I got and the amazing work that I was able to do on the nonprofit level. But now on the governmental side of things, I'm responsible for overseeing the EHE funds. And so we have funds from HRSA, and we have funds from the state of Michigan by way of the CDC. So the really cool thing about my job and the work that our team is doing is creating these opportunities for people like all of you all and at your organizations to come up with innovative programs and projects that you know, because you work in the community, like you know what the community needs. You don't need people like us saying what you need to do. You all already know what needs to be done. Tay, you're talking to people in the community every single day. So the work we get to do is to provide funds and provide a plethora of funding opportunities. And unlike the restrictions for a lot of Ryan White Part A providers, the ending the epidemic money is a lot more flexible. And so our target population, LaDon, we're able to address more than just a certain subset of individuals, whatever it takes. Because again, everybody is at risk for ending the HIV epidemic. I know it came, the federal government wrote up a piece about PrEP and feedback that they got that a lot of women felt that it wasn't for them. So they didn't ask their providers about it because the commercials, the different things that we see, people they didn't feel that PrEP is something that they should be on. So the work we're doing is amazing. I have a great team that consists of 2 senior health educators, Rita Little and Keith Hughes. And then I also have a public health detailer, Maglina Mihailova, who is doing some great work with clinicians. So we're really excited to be able to provide funds, but also be that catalyst to kind of create and maintain non-traditional partnerships. So like strengthening allies in the community too, I think is a big part of the work that we need to do to end the HIV epidemic, because stigma is like the overarching theme for all the work that we're doing. And so we have to do more than just preach to the choir. We need to really, really get out there and get the message out there so the community knows. So yeah.
Thank you. Thank you. Dr. Riddle, Curtis.
All right, so I think you've heard me say it over and over again. I'm trying to get y'all some better doctors, and I'm trying to work on myself too. So I'm constantly learning. We're all learning, but at Wayne State, we have 300 medical students, more than 300 medical students who come through and start every single year. So I have 1,200 plus medical students that I'm working with on an annual basis. All the internal medicine residents, the pediatric residents, and the med-peds residents get to hear me talk about PrEP. And the pediatric residents are shocked that they can give PrEP to 12-year-olds. And so that's just blowing my mind. Like, how long has it been approved for 12-year-olds and up? So, thank goodness the city of Detroit has the Either Side clinic, because then I can send my 12-year-olds who don't want necessarily their parents to know, what's going on. We can still provide access. So I'm trying to get y'all some better doctors, and I'm working on myself constantly. So that's what I'm trying to do.
I appreciate that. Curtis, go ahead and close us out. How you make an impact?
So HIV and AIDS is a Black disease. HIV and AIDS is an LGBT disease. It's ours. We own it. We therefore will find solutions to improve the quality of life by either ending the epidemic, helping those who are living with it. Every day, you have to consider investing into a safe, brave space so that if you believe you are impacted, affected, infected, diagnosed, there's a place that you can go that somebody can hear you. That place must exist so that you enter, meet somebody who understands what you may be going through. You may be needing a cry, maybe needing a laugh, maybe needing a hug. And after that, find a primary care, secondary care, a support group, a big mama, an auntie, big daddy, big uncle, somebody that culturally understands what help looks like and how that can be offered. And so every day, I have a great job. This safe brave space allows an entrance for those who are considered others or who believe that they to be others to come in and to freely express themselves, freely express their needs, and therefore get the help that they'll need. It is working with all kinds of people on this call, those who work in many municipalities, many kind of medical care supervisions and provisions. And of course, a whole lot of advocates who understand what it is to either know the shoes that you're walking in or may understand the feelings that you're possessing at that moment. There has to be an investment of that space. The LGBT Center is the first space most known when people are diagnosed with HIV. That center is important because it isn't so that they'll see a doctor or they'll see a person from a governmental office who may understand initially. It is true. Not many care providers know the language and know what it could be or have the empathy to take care of somebody newly diagnosed. And so spaces like these are important. They need to be preserved. Investments must be made so that we can enter and fan out those that need help. That's what I do every day. And I am inspired by new warriors who come in to take on the challenge. My job is to make sure that a foundation is laid so that when that person comes in, you don't have to work hard. You don't have to start all over again. You just pick up the resources that are there, use those resources, and carry on the good work.
Thank you. That was a beautiful closer. I'm appreciative to all of you for joining me tonight on The Work Continues, Black HIV Community Leaders Converse. I really appreciate all of your perspectives, and I'm sure our audience will too. This event is powered by the state of Michigan and the city of Detroit as a part of an anti-stigma ending the HIV epidemic campaign we entitled Togethr. Together, we see each other beyond a diagnosis. As friends and lovers, we challenge HIV stigma. By protecting safe, brave spaces, we can live openly and play together. There will be a link in the metaverse somewhere for our audience members to be able to fill out a survey and provide us with feedback on the things that they learned. So that will be there. Other than that, I hope you all have a good rest of your night. Thank you for joining me and talking to me, sharing
You
space.
did a great job. Thank
I appreciate
you so
y'all, even with the technical difficulties.
Good job, Ty.
Yes.
Thank you for being
Thank
a part of
you.
this opportunity. Thank you all.
Thank you all.
Yes, thanks for having me.
Have a good night.
Goodbye.
Bye.